Hi, I wanted to come on here and talk about my experience of having my weight loss surgery in Mexico. I had my surgery on May 15, 2015, in Tijuana, Mexico. My doctor is Dr. Fernando Garcia Govea, and let's see here. I'll start off with my weights. My high weight was March 15, so about 2 months ago. I was at 275. Day of my pre-op diet, I was 262. And day of surgery, I was 247. And right now, I am 6 days post-op, and I am still up a pound. When I left the hospital, I was up to 256 from all the fluids. So I still have some of that water weight to get back off. And I'm hoping I'll have a better loss tomorrow. And I also think I'm losing a little slower because I have lost 27 pounds in the last 2 months. So I'm okay with that. It's all right if I have a slow loss at first. I haven't been super active. They told me to take it pretty easy for the first 2 weeks. I've been doing walking, and that's really about it. So I'm going to get into talking about kind of like what happened from the time I left to the time I came home 2 days ago. So the day before surgery, it was Thursday, I left Michigan. I live in Michigan, so I left around 1 o'clock in the afternoon, and I ended up getting to San Diego at 8 p.m. It was a really, really long day. We were flying for about 10 hours. I was with my dad. It was just because it was the cheapest way to get flights out there. We had to take 3 different planes. So that was really miserable. And the day before I left, I started feeling like I was getting a cold, and that was really hard. Alex, you have to be quiet, please. So I started taking Zicam, to kind of help me get over that cold a little faster, and it ended up working great. So I really didn't have like a terrible cold while I was there, and it didn't interfere with my surgery at all. So I got there at 8 o'clock. The driver called me. Well, I should say his name was Ricardo. He called me the day before I left Michigan. So I had his phone number in my phone, and he told me to call him as soon as I got there. So I called him and told him that we were at the airport, and he said, just come outside and tell me what letter you're standing out at. And he came right up and picked us up. It was raining like crazy when we got there, so it ended up taking us about an hour to get to Tijuana, and it was super easy going into Mexico. We didn't have to stop. You just kind of slow down, and they look inside the van and make sure there's nothing suspicious, because getting into Mexico is the easy part. So we got to the hotel. They and I didn't know this going into it, that during your stay there at the Marriott, they let you have 2 bowls of chicken broth. Or no, I'm sorry, 3. They let you have 3 bowls of chicken broth a day for free, and 2 bottles of water, and 2 popsicles. And the popsicles were terrible. They were like I don't know, like watered down orange juice, homemade popsicles. They were terrible. So I didn't have any of those. I tried one, and it was terrible, so I didn't get any more. But then I got the chicken broth, and the chicken broth was great. A few times it was a little watered down, but overall it was pretty good. So I thought that was really nice of them to do that, because I've heard people on YouTube say, I'm waiting for my chicken broth to arrive, and I was thinking, oh, I wonder how much that's going to cost. Because, the cost of the surgery was big for me. I don't have a lot of money. I'm a single mom, and I'm a full-time college student, and I work part-time to full-time. So every penny counts for me when planning this kind of stuff. So that was awesome. I was really happy to find that out. Then let's see here. We went to bed that night, and it was really kind of a cluster because I was trying to get a hold of the coordinator, and I wasn't sure like who's supposed to be my coordinator or what was really going on. And so I ended up getting a phone call at the hotel room at 11 o'clock at night. Excuse me. And it was from my nurse, and her name's Atalia. And she was super nice, and she was just explaining to me what to expect, that they would be there to pick me up at I can't remember now, like 6:30 in the morning. She said, get checked out of your hotel room and just wait for us in the lobby, and we'll come pick you up. So they came and picked me up, and I was, thinking, oh, this is, probably going to be a really quick day. Like, I'm going to get in there, they're going to do blood work, and we're going to be doing surgery. My surgery wasn't until 5:30 that night. So it was a really long day. So I got there, and there was 3 of us that were there. 2 of us got a sleeve, and the other person got gastric bypass. So me and this other guy, we were kind of on the same schedule while we were there. So we got there, they took our weight and our height, and then they brought us to our room. And I totally lucked out for some reason. I don't know. At this place, it's called CER, and I wasn't expecting it to be there. I thought it was going to be at Florence. So I guess I didn't check all the information out. Dr. Garcia has it on his website that they did just switch over to this facility. And I would like to clarify something on this. As an American, what I was at was a clinic. They call it a hospital. In the U.S., we would call it a clinic. It was not a true hospital. So, that's fine that they call it a hospital. I felt like I was fully taken care of there, no problem. But if you're going there expecting it to be like a full service hospital, it's really not a hospital in the way that you would think of it in the U.S. It's definitely more of a clinic. So, but it was really nice. It's like a newer facility. Everything is very clean. The staff was really nice. There were a few things, and a lot of this has to do with the fact that I'm a nursing student. So I can pick up on a lot of this stuff that maybe other people wouldn't realize. But I don't know if the people that are taking care of you after surgery, if they're actually nurses or if they're like techs, like maybe like a CNA type person that we would have here in the U.S. But they can do a lot more. Like they were setting up my IVs and giving meds, and like in the U.S. you have to have some kind of licensure to do that. So I don't know. All I know is there was one that probably shouldn't even work there. She had no idea. She doesn't speak English, and she set up my IV when she was giving one of my meds, and it was a med that she was giving like a secondary bag, and she had air in the entire tubing, like the whole tubing, and I'm like, are you gonna prime that tubing, because it's full of air, and I really don't feel like that needs to go into my venous system. So she just kind of looked at me and was like, oh, okay, and got all the air out of it, but I don't know. She was the only one, I swear. All the other ones were totally with it and knew what they were doing. And there was always somebody there who spoke English. So that was never an issue. If there was something I really needed to report, there was somebody that I could talk to in English. So, all right, where was I at this? We were getting ready for surgery. So I got to the hospital, into my room, and my room was really nice. They were all the rooms are called junior suites, and there's like 2 large suites, and I totally lucked out and got one of the large suites. So, which was cool because I was traveling with my dad, and it kind of gave us a little more privacy. So that was pretty cool. And but there were a few things that I didn't like about the room. The bathrooms are really nice. They're pretty. There's no counter space. They have this beautiful glass like floating bowl for your sink, but there's no counter space to put anything. There's this like little tiny shelf under the mirror, and that was really about it. And like my dad brings all kinds of crap with him when he travels, so pretty much he took the whole thing over. And it wasn't a big deal for me. I'm used to it. I got kids, so I'm used to sharing my space. But yeah. Oh, and I didn't get any washcloths. There was like no washcloths in this place. So I've heard other people say before, like the washcloths are like sandpaper, and they were at the hotel. But at the hospital, there were none. So if you really need a washcloth, take one with you, I guess. I had like my oil of Olay wipes that I brought, so I just kind of used those, and that worked out pretty good. So, all right. So I was in my room. One second. They came and took lab work, and the guy who did the lab work was great. He was able to draw the blood super easy, no problem. And then they came in to start my IV, and I got this, I don't know if you can see it there, that nice bruise right there. I tried to tell them I have a really hard time getting an IV in my hand. So, they tried here first, and I knew this wasn't the right angle. They needed to do it more in here. But they tried it, couldn't get it there, and then they just tried to do it in my hand. And they did get it in my hand. But guess what? It failed. It did. And I knew it would. But, whatever. It's no big deal. So, yeah, I had my IV fluids going. They give lactated ringers. If you know the difference between IV fluids, it wasn't normal saline, it was lactated ringers. So, pretty much that's what they gave me the whole time. And then they started an antibiotic like right away. And then let's see here. Then they came in and they gave me, God, I want to say it was clonidine. And some other like liquid medication. So I took those 2 medications, and then I had nothing to eat or drink that day. So because the day before surgery you can't eat anything after midnight. So I had nothing in my stomach at all. And then we just kind of waited around. The surgeon came in and talked to me, and that was really like brief. I just talked to him for a second, and then he just said that he was just going to do those 3 surgeries that day, and they weren't sure which order they were going to do them in yet, and that they'd be coming to get me in about an hour, and it ended up being like 4 hours. So I don't know, it wasn't a big deal. So I waited for the surgeon, or waited for them to come get me in the room, and that was about 5:30. So they came up and put me on the table, or the bed, to take me downstairs, and then we went downstairs. They the way it was set up, they have like a recovery room, And they had me kind of waiting there on the bed until they had the room, the OR prepped, because they had just gotten the other patient out. And so I just waited around until they brought me back. They did tell me when I got in there that I needed to have all my jewelry out. Well, I have this pierced, and I have had this earring in for 14 years. And I'm like, I can't get it out without a pair of pliers. So, I had no idea that they were going to tell me that I couldn't have any jewelry in at all. So, he just said, well, if it interferes with the equipment, he was going to have to cut it off. And I was like, whatever, there's nothing I can do about it. Just be gentle. So, that's really the last thing I remember, because he shot something into my IV and I was out. So, and then I woke up in the recovery room, and I remember looking at the clock, and it had been an hour and a half later. So, I'm not really sure how long I was there, but that's all I really remember. And I was really happy and feeling in a good mood. And when they brought me up, he said I was doing wonderful. So, and they didn't have to cut my earring off, because it's obviously still there. So, yeah, it really was not bad at all. It went super quick. I had 3 incisions and a drain. So I have 4, I'll have 4 scars on my abdomen, but I was expecting to have like 5, because I was pretty sure that like this type of procedure you have 5 incisions from it. But hey, whatever, not complaining. So yeah, we went back up to the room, and I was feeling so good. And then that night, it was the worst night. They told me you might throw up blood, and your first bowel movement might be black from passing blood through your GI tract. Okay, honey, can I finish this video and then I'll help you, please?
Yeah.
Thank you. So, where was I at? Surgery, recovery, night. It was the night. Yeah, so they said that I might pass some black stool, and that would be normal. Makes sense. So, I tried to get some sleep after that, and I was kind of in and out the whole night. And then I woke up at probably 3 or 4 in the morning, and this was when the nurse that almost shot a bunch of air through my IV was working. And I told her, I'm like, I'm feeling nauseous, and I'm not feeling good. And so she left, and then it was like 30 minutes later, and I pressed my call light, and I was waiting. Nobody came out. So I got up, and I walked out to the nurse's station. I told her, I'm like, I'm not feeling good. I'm in pain, and I'm nauseous. And I didn't even have an Empson basin to like throw up in. So she handed me one of those, and I went back into my room, and I waited and waited. And then finally, like, I was still standing up because I couldn't lay down. I was feeling so nauseous. They both came back in, the 2 nurses that were on that night. And like the second they walked in, I started throwing up, and it was blood. It was bright red blood. And it was just like, told you guys I was nauseous. Told you I was in pain. Not a big surprise that I'm throwing up. So, yeah, that was the only time that I threw up after the surgery. And I'll tell you, it sucked. It felt terrible. And I'm so glad it only happened once, because that was just like the worst throw up in my life. And yeah, so they gave me some anti-nausea medicine after that, and it was great. I was totally fine after that. And then I just kind of stayed on top of, like, if I'm feeling any pain, I told them immediately, and they were really good about getting me the pain meds. Let's see. After the surgery, they have you drink this, like, the next day. It's Gatorade that they add, like, a blue dye to. It's probably like that methylene blue stuff or something. So you have to drink that, and they try to see if anything blue comes out of your drain. That's just a way that they can see if there's any leaks at all. They also had me do that day 2 after the surgery, which was the morning that I was going to be leaving, and there was nothing coming out of my drain at all. So let's see. That morning, it was Sunday, me and the other guy, we had to get picked up and brought to a radiology center because they don't have an x-ray machine at this clinic or hospital. And so we went there and had to do the barium swallow, and they just took a picture of our stomach to make sure that there were no leaks. And I've done a barium swallow test before, and it was like real chalky. It's just the kind that I've used before. So I was expecting it to be like that, but it wasn't. It was a clear liquid, and it tasted really bad. It was just like drinking bad liquid medicine. That's about the only thing I can equate it to. And I got it down just fine. And in fact, I was surprised I was able to drink the whole cup. I think that was the most fluid I had drank at like one time after my surgery. And, it went down just fine. It didn't upset my stomach at all either. So, yeah. And then they got this picture of my stomach, and I got to see it, and it was pretty cool. And there was no leaks. So we went back to the hospital. They removed my drain, and I took a video of that. I'm going to post the other videos later. That was pretty cool. So it didn't hurt at all to get the drain removed at all. And then, I did get staples on the outside of my incisions, and total I had 6 staples. And I was kind of surprised because I was thinking, ooh, this doesn't seem like this is enough to hold all this closed, and I don't know, I was a little freaked out by it. But it's healing really, really well, and I'm really glad that he didn't use a ton of staples, because I'm going to have pretty minimal scars when I get all healed up. So they discharged me from the hospital after they took my drain out, and I went to the hotel. And the day before I left, so it was Monday, the nurse came to the hotel and removed my staples, and she put steri strips on my incisions. And then she also cleaned my incision from my drain, because that is kind of like an open seeping wound still. They never closed that up, so I'm probably gonna have the worst scar there. But yeah, that was pretty much it. After that was the last time I saw her, and no, it wasn't. She went through the border crossing with us. So Tuesday morning we woke up early, and we were out of the hotel by 7 a.m. and we made it to the airport before 8 o'clock. We got through the border super quick, and that was so easy because they have that medical lane that we went through, and you could see the lines backed up like crazy for the other traffic that had to just go through the regular lanes, and there was maybe like 8 or 10 cars in front of us in the medical lane. It was so fast. I just couldn't even believe it. But yeah, it was super easy. The flight home wasn't bad at all. I brought kind of like broth concentrates home with me, And it was, I mean, nobody charged me for a cup of hot water the whole way home. So I was able to just add that to hot water and drink my broth and, drink my bottled water. And it worked out great. So I've been doing really good keeping my fluids down. It hasn't been a huge problem at all. And really, that's about it. I did want to show you the meds that they gave me, that they sent me home with. All right, so the first one is, I'm not even going to say these because they're not in English. This is what they gave me for pain. And you take it every 12 hours. There's only 6 tablets here. You take one at a time, and I only used 4. I haven't been feeling a whole lot of pain. I'm using Tylenol now that I'm home, and that's working just fine. And this is one of those medications that you put under your tongue, and you just let it dissolve under your tongue. Let's see here. And then they gave me this antibiotic. Theirs come in like these boxes, and then they're like individually wrapped in a foil pouch like this. And these things are horse pills. They are huge. And I've been swallowing them just fine. So, don't worry about it. You're going to be able to get it down just fine. This is what they look like. It's a pretty big pill, considering I just had 80% of my stomach removed. So, but yeah, it's not bad at all. You'll be able to get those down just fine. And you take these every 12 hours, just one of them. And then they sent me home with this. I'm supposed to take it every 8 hours, but I just take it every time I take the antibiotic, just because sometimes these antibiotics cause GI upset. So she said just take this with your antibiotic, and it should help with that. They say you're supposed to finish this whole thing. I think this is the same thing as milk with magnesia in the U.S. And I'm going to use it, but I'll probably end up switching over to like Prilosec, omeprazole, something like that. So just because that seems to be what a lot of other people use, when they're having acid problems. So it's probably going to be something I'll use. I've used Prilosec before in the past, and it's worked fine for me. And then they gave me this spray. It's just an antimicrobial spray. And it's for spraying on my incisions to make sure I'm not, getting any bacterial infections around the incision sites. So I will show you my incisions really quick. And I think that's really about all I have to say, because this has already taken 30 minutes. So there's a lot that happened to me while I was there. So if you're still with me, thank you for bearing with me. Okay. All right. So I had one staple in here, so she only put one steri strip. I had 2 staples here, and I had 3 in this one. This is probably the most sore one. I think it has more to do with the fact that the drain was right here. And it was also the largest incision, and where they took my stomach out. But I don't have one up here. I've seen a lot of people who have them up here, and I don't have one up there, and I'm pretty happy about that. But yeah, I had those 3, and then the drain. And I'm really not crazy about where the drain ended up being, because it's like literally on one of my stretch marks, and I wish you would have just gone a little further over. Because it's going to have a hell of a time healing on that stretch mark. But otherwise, it's not seeping a whole lot. And, yeah. So if you have any questions about, going to, I went through Tijuana Bariatrics. So if you have any questions about that, that's what I know. I don't know about any other surgeons. If you're going to have your surgery with Dr. Garcia, let me know. I think it's great to network with other patients. So, If you are having surgery, good luck. You will not regret it. Thanks.